Does it say we're live yet?
I don't know. I'm just checking on my phone to see what's going on.
I think we're live. Hi, everyone.
Yeah, it
So
says we're there.
great. So we're here to do my first live telehealth visit, specifically on how to troubleshoot your own tongue function issues. And even I've never evaluated someone over Zoom, so I'm going to see how that works. Hi, Chantel. Thanks for joining. Um,
Oh, hi, Michelle. Hi, everyone. I'm just so excited to be there and to be the
Yay!
first. I like being
Yay, yay,
first.
yay, yay. So we actually communicated a couple of weeks ago and you told me some things and I don't remember any of it because it was very brief. So now the part of is, learning a little bit about what's going on with you and what's the history of that.
Mhm. Um, well, I watched one of your videos and I was very intrigued, but all you said about the tongue and that the tongue, um, there was this part about like the back of the tongue should touch the soft palate. And I'm like, my tongue doesn't do that. And then there was this other part where you said that these little bones that grow in your because your mouth's going like that because you talk.
Mm-hmm.
So I thought, oh, I've got one of these bones, and I've asked my dentist, and he says, oh, it's normal. People have that, but it's been growing bigger. And I'm like, we don't want that. If there's something I can do to stop it, then I want to do it. And yeah, so since then I've been watching tongue videos and doing tongue things, and something magical happened. I was already before all this, I was already doing some swallowing exercises in the morning because both my grandma and my dad had trouble in their old age with the swallowing. They wouldn't be able to swallow. And sometimes when I'm very nervous, it does that. I'm like, and it so I thought, well, I'm going to keep that muscle going. So I was doing 10 swallow, one behind each other, but my mouth was always dry and it was always very difficult to do. But since listening to the video, and they were saying, put your tongue a little bit away from your teeth, and I found the one spot, and when my tongue's there, saliva just pours down my mouth, and then I can do the swallow because there's saliva there all the time. And it's just magic. I was like, how come there's so much saliva? And I notice every time I put my tongue there, then the saliva starts flowing. It's like a fountain in my mouth.
Exactly. So, well, there's a medical reason for that. You ready to hear it?
I am sure I am.
Right. So the contact of the tongue on the back of the hard palate and the soft palate actually elicits the parasympathetic response, which is the domain of secretions. Which is why when people are having asthma attacks, we give them sympathomimetic drugs that mimic sympathetic states to dry up and expand the airways as well. Isn't that interesting?
It is. So all I did really was pull my tongue back a little bit and that helped for it to be able to go at the top. It was back
Mm-hmm.
a little bit. And it didn't take much
Mm-mm.
practice for it to change. It was just really a matter of pulling it back. And at first, like it felt like there was not enough room. It was like weird for the past, I don't know, first 2 mornings or something. And then it now I couldn't do it any other way.
Wow, that's really amazing. That's a quick turnaround. Lots of times folks have a more difficult time than that, but the tongue will change shape. Like all these soft tissues will morph and remodel, and the body actually uses the gas mixture from the nasal passages, nitric oxide, to change the shape of the oropharynx or the oral cavity. I have some sun here. And it does that because there's erectile tissue in the back of the throat. So the body can actually use that. And what it'll do is it'll change the amount of air coming into one nostril or another to raise the levels of nitric oxide in the body. That will remodel the shape of things. I know it's really crazy. But one of the things you probably were doing when you put the tongue in the right spot was taking more air in from your nose than your mouth, which would have given you more carbon dioxide and nitric oxide to work with. But I think of something more interesting, which is
Sure.
that it is like it's like the tongue palate connection just locks in so much of the wiring. It's like an orientation for the whole body to kind of come online and come into focus.
Yeah.
And it's like a ripple down effect. It changes the endocrine state, like how much your body's in fight or flight or restoration. um, and it has the body kind of kick into a more proprioceptive or cerebellar. In the bottom of the base of the brain is the part of the brain that kind of we use to sense like where we are in space, and somehow that comes on and works better as well. So it's interesting, apparently, in the horse world, in the horse racing world, if a horse is injured and there's a tongue palate dissociation, they know the horse isn't going to come back and be a winner again, because everything's just going to be hard. They won't be able to really come into their focused power. Isn't that interesting?
That's the thing. The other thing that happened when I first started to do these exercises is my palate was sore. There was just so much pressure
Yeah.
on my palate. It felt like a bruise. And I went, okay, now it's gone. It took
Yeah.
maybe a week or something, and now it doesn't. But at first, it was like not sore, but hurting, because the tongue had never pushed so hard there or
Yep.
something.
It's like a change. The tissues have to get used to the pressure.
Yeah.
So there's two things that are, this is, you're the most amazing case, and I had no idea. I just had this draw to work with you, and the things you're saying are magical. There's two things that I know, well, I'm sure there are more, but two things I want to talk about right now are the fact that you have these accumulations of bone on, are they on the below the tongue or on the roof of the mouth?
No, the pillow.
Yeah. So what that means is they're accumulating there because the forces aren't that are naturally going to be starting to move through your face now that your tongue's doing more of the right thing. The bone responds to the forces that are placed upon it. That's called Wolff's Law. Like if we stop using our bones the same way, they're going to change shape. Like when people are quadriplegic and what have you, they don't, obviously, because we use resistance training to strengthen bones in osteoporosis. It's very obvious mechanism. Nobody argues about that. What we do argue about, however, or not argue, but we differ in opinion with most dentists, is that the bones of these bone accumulations won't are normal. I don't, osteopaths don't agree with that.
Well,
There
I
are many.
realized when you said that, I went, no, it's not normal.
Well, no, it's not normal, but it's commonplace to assume that. That's the narrative. The less functionally oriented look at the face, because dentists are just straightening the teeth. They're not looking at how the crowding of the teeth reflect the crowding of the whole skull. So one, I want to just say, once I really started working on my own stuff, I had a fairly, I don't know, half a centimeter lump of bone on the roof of my mouth. And within 4 months, that was gone completely.
Wow.
Now, one of the things that can add for you to get your head to release a little so that the bones can morph a little bit more and be shaped by the tongue more easily is to do a little cranial release on yourself. So I imagine you don't have an osteopath, but even when people do,
I
some,
do. I have a wonderful
oh,
osteopath.
you do.
She's magical. I
You're
send her to
so,
her website. I says, you have to look at what Michelle's doing. I want to talk about that with you next time we see each other. She's a real witch. I love her. She's really amazing.
oh my gosh, that's
She's
amazing. Well,
brilliant. Yeah.
now all of this is making more sense because your rapid recovery and like really huge gains in a short period of time are probably because you've had such wonderful cranial work. The body's breathing. The body's breathing and fluid and mobile and ready to be patterned anew by your behaviors. So it really can just take little tweaks, and the body will reshape itself quite wonderfully as long as we're not fixed. So for the people who don't have an osteopath, what I say is, this whole study group's about being your own osteopath, because I
I
do
like that
believe a
idea very
lot of
much.
it Yeah, really, really possible.
So you were telling me to do the cranial work, but we got stopped because I got
Yeah.
excited about. So how
Well,
do we
that's what
do
I'm
that?
saying. Well, actually on my website, michellevenezianodio.net, there's a little still point inducer, which is like a rubber thing. It's a rubber, it sits on the ground, but it has two rubber mounds on it. And that's a fancy thing you can do to kind of put under the base of your skull to just release all this musculature that gets so bound up, especially when we sit low. So this is a segue into the seat cushion thing that you started talking about before we got on the live. This is so good. So people can just throw two tennis balls in a sock and lay on the floor and have them right in that musculature, right at the base of the skull where there's that nice big kind of drop off, right? Right in that.
You mean that like
Yeah.
groove between the two bones sort of thing?
Well, right, if you go from the top of your head back and then whoop, your hands hopefully fall into a little bit of a gully right at the
Yeah,
base of
yeah,
the
okay,
skull.
yeah.
I put the tennis balls right, there's like two kind of protrusions on either side of that hole.
Yeah, yeah.
And I put them on the muscles that cover those bones and I wait for the response. Like at some point, the whole thing will start to go. And
Okay.
so that's a release on the cranial base. And that will spread throughout the whole skull and it'll also go down the spine and be reflected in the tailbone. So you could do at the same time, right? Because you don't see your osteopath every day. But
No,
you
I don't. I don't. And I don't see her that often because she's in Montreal, which is 4.5 hours away.
oh my
She
goodness.
used to come treat people here for 2 weeks every month, but with the COVID and all that, she's not
Oh
been here
yeah,
in a
yeah, yeah,
while now.
yeah,
So
yeah. Okay, perfect. So that's exactly the case probably for a lot of people. So, and here's the thing though, even if you have an osteopath, that's amazing. But what we're talking about is how the body morphs in response to behaviors. That means things you do all the time. You're not with your osteopath all the time, but you can be sort of attending to cranial and sacrum release techniques um, often whenever it feels good. I do it most days, but I kind of do it all the time just with the way I'm sitting. I tune into that spine as a fluid connected to the earth and connected to the sky. But
can
I,
I tell
oh,
you something?
yes.
Every day I have on my work, all the work things I have a link to that text about how to sit like a weed on the cushion and blah, blah, blah. And every day when I start work, I read that and I do that every morning
Oh my goodness.
religiously because it has changed. I don't have any more pain at the end
I
of the day
know.
with the cushion and then sitting like that and thinking about it. I do that every morning.
So I have a favor to ask you in this moment. Well, it's a desire I had that arose in the moment. Can you show everyone the cushion? I didn't even know you got it, and then read us that thing. Like show us what you did. Right? So
That's the cushion
that you got on my website.
that I got on your website. And that, I mean, I never used to sit in front of the computer all day, but I do now. And I had pains everywhere and I try adjusting and everything. But since I've got the cushion, it's
Yeah.
just,
So
I'm
I have
happy.
one too. I want to show you guys. I don't make money on these things. The links are on there. I think I make $2 or something. So the point is just to have the really good things available. And this is not memory foam. This is sturdy. Like memory foam just collapses. This thing will actually make it easy to have your hips a little higher than your knees. And then when the spine then is in neutral, it can rise up and maintain this subtle snake-like action. It travels all the way up the neck and it keeps that bunch of muscles at the base of the skull from binding up and locking up the skull, the nerves to the tongue. This whole thing goes to sleep when we sit in a collapse, right? And the whole spine goes crazy. And that's why people have pain 90% of the time, having them just correct what their relationship with their chair.
Yeah. And see, my back is not on the chair anymore. I
Yeah.
sit away from the chair
Yeah.
and I don't get tired.
Yep.
I do get tired, but my back doesn't get tired. I mean,
No,
before
you're
I would
not
get off the
using.
chair and I would like ow, ow, ow. It would hurt everywhere. It
Yeah.
doesn't anymore.
You're not using your back the same way. You're engaging like a whole trunk of intricate musculature plus energy. Plus, you engage your midline, you start to run your life force differently. But you also get to access the ground, the support of the earth more spontaneously. And don't underestimate that. Like, these martial artist guys who manage to like send a whip through their body and break these big stacks of boards. They're translating from the earth. The earth energy comes right through their body and they can focus it and direct it and boom. So it's no joke. Like, you can have so much more energy and comfort and pleasure and enjoyment and creativity because your brain's going to be more awake, right? You're going to be more in a good mood. Your joy is going to come through. You can be able to spread it to everybody.
Yep. I mean, it's that cushion is really like, it's a
Yeah,
wow.
it
It's
is.
really a wow.
And she went ahead and bought it, even though to send it to Canada, the
It was
shipping is
double the
as much
price.
as yeah, so it was over $100 for you. I
Yeah.
think the cushion, I don't remember, is it like $40 or
Something
something?
like that. Yeah. And then it was like $34 shipping and then the translation into Canadian dollars and da da da.
Yeah,
But
yeah, yeah, yeah.
it was worth it. It was
Well,
definitely, I mean, you don't
so
need to
what?
buy one of these fancy chairs, it this just does it.
Yeah, exactly. Exactly. You can make something that works out of just about any surface with the right props.
Yeah.
But then I want to say, once I get really fluid, I can make any chair work. I become so much attuning to this staying in this dissolved morphable state all the time that I can cheat tons. Like, I'm really someone who's like, I want to be adaptable and be able to stretch my range by not treating myself with kid gloves, but rather going, oh, I need to work with a flatter surface. I need to draw a little bit more from the ground, and I need to kind of like, up my game a little bit. And I even sometimes use high heels to do practices that heal my spine, which is another video I want to do. Like, I don't wear
Ooh.
really, really high ones. I think they're like 2.5 inches, but they're a little platform. And I can tell that because this sitting flow practice is also a walking practice. And as long as I can use my whole foot in the gait, and sometimes that means I'm working my legs in a way that I wouldn't do most of the time. But as long as for some of the day I kind of work every joint and the whole lower body like a spring, like when I go to the bathroom in between patients, I'm like, let me walk like a
Like
like
a
a
planter or something.
yeah,
Yeah.
exactly, like a predator down the
Yeah.
hall. It's very slinky. It's very tango dancing. So sometimes people see me and I'm always doing weird things, and I'm okay with it. I'm having fun. Usually people are pretty into that.
Yeah.
Um, yeah, so my thing is, I know when I say props, it's like, oh, you have to have all the right pillows, and and I'm just like, we get into a place where we become more fragile because we don't stretch what we're capable of in response to a challenge. And I'm really
Mhm.
all about kind of leaning into difficulty and getting more resourceful around it. And then sometimes I throw in the towel, and I'm like, oh, I just need to you know, do the lazy, comfortable thing in the moment, whatever feels right, for sure. But I love what you said about how you have more energy and in the course of sitting in your chair, how many people? I can't tell you the revelation I had one day when I was like, oh my gosh, I see so and so every week. It's the people who have to see like a chiropractor or someone every week, and I'm like, that just doesn't add up for me. So once they started, having people put these basics of self care in place that are not hard to follow because they feel so good, you know, I have way less patience, but that's okay because I had way too many. So it's really brilliant. Like, I get so sleepy and bored if people aren't progressing. I'm very, very outcomes focused. So great. Well, oh gosh. Oh no, I'm good. We're good time wise. Tell me, we have maybe 5 more minutes. Anything else you want to troubleshoot while we're on together today?
um Well, I wanted to make sure that I'm doing my tongue is positioned correctly when I swallow and all that.
Mm-hmm.
But I think I'm, with all the videos that you sent me, the links that you sent me, and I watched, I think I'm pretty good.
Mm-hmm.
Um,
I have a tip.
Go on.
So this, I actually have a picture. I wonder if I can bring it up and show you guys. I might try a share screen and see if it works on Facebook Live. Because there is a 2/3 of the palate at least is the maxillary bones in front, but then back toward the soft palate, the palatine bones are what connects to the soft tissue. And so there's a little X. Anybody can take a picture of the roof of your mouth. There's a little cross back there. You want the back of the tongue to be hitting that cross. And you know how you can tell? The sound. And you can see how you can feel underneath how the tongue goes right up and you get a little like divot where your finger, it's a bigger divot if you swallow, right at the back of your, right in front of your neck. But then when you do, and then you memorize, see if you can do the K with just the back of your tongue. It's tricky, right?
Yeah, I see. That's the part that I haven't got. When you showed that, I'm not getting
Yet.
that hole there.
Yet. Well, okay, so if you do open your mouth, it's easier if you open your mouth, grimace, and swallow. Do you feel the tongue going up here? Can you see how I'm doing it? I can't see while I'm doing it.
Yeah, okay, let me do it.
So head back a little bit because you want the ear over the shoulders. We're going to start to get your spine more skybound. So you tuck the chin a little. You are going to be in mountain pose. Mountain pose is like long, right? Opposite poles. Crown goes toward the sky, tail goes toward the ground. And there are some nuances to that in yoga. You can look up mountain pose, but there's a shoulders are a little back, shoulder blades come down, but we're not stiff. Nice, that looks way better. Now, is it a little easier with your neck long? I want to see, let me see if I can see you better here. I'm going to pin your video for everybody. Pin, there she is. Well, you can actually drink water to have yourself swallow. That helps. You can keep that water glass and yeah, there you go. Perfect. See if you can use the other hand so we can see underneath your tongue. All right, so now swallow. Tuck the chin a little neck a little bit back. I see it. It's subtle. It's gonna.
I feel a little movement. I can't tell if it's going in or pushing out or.
Doesn't matter because now you know what to look for and you're gonna work it. And just putting your attention on it is gonna start having it respond and change. And then we're gonna get to have a follow-up visit with you. I'm gonna give you 2 weeks to practice that and also send me a picture of your palette so I can I actually put my iPhone in my mouth and take a picture of the roof. It's tricky, but it's all fun. And now before we close, I just want to show you all this. I'm doing a lecture for Rebel Health Tribe on Monday. It's a big group. It's like 50,000 people.
Oh my.
Well, 50,000 subscribers. Who knows? But I'm in good company. There's a couple doctors that are really hot stuff in there. Okay, so let's see if my if I can share the screen and make it work. It wouldn't work before. It was giving me problems. So let's see here if I can. Oh, I could show everybody and keep the live on my. I don't know what I'm doing. We're gonna. I'm picking share screen, and then am I gonna see you also? Yeah. Okay. Can you see this?
Yeah, we can see that. Yeah.
So this, I can't play the slide. Can I play it? Maybe I can play the slideshow. Okay, so that is the comparison of a palate that grew without the tongue on the roof, and then a palate that grew with the tongue, able to create the shape of the dental arch as well as spread the whole face, creates all this additional space. Um, and then the teeth don't end up needing braces. And the airway gets to widen in this process of morphing. The palate is actually potentially going to move the face forward and down. I actually grab people's bones at the right moment and start. I move them like clay. That takes a while to get them to the position place where they are able to do that. This is a just as comparison. I don't want to go into it now, but this visual is on the study group with the article that explains what all these things are. Proper tongue posture, not just the tip, not just the front half. Hello, there's the back part that we're talking about. And then this is what I wanted to show you especially. This cruciate suture, where above this inside the head is actually the craniosacral hinge. It's the it's this junction of the sphenoid and the occiput, but if you can move that, you move everything. That big hinge, biggest mechanical junction in the body aside from the lumbosacral junction. So this is why I say a well-functioning tongue is like having an osteopath living in your head. It's going to mobilize your entire craniosacral structural spring-like mechanism in the body, which then is reflected in the nervous system coming into balance. So that's what an osteopathic treatment is. Bones return to spring action, nervous system comes into regulation, and the subtle body does as well. So this is we're moving toward integrating the physical body. The nervous system is included in the physical body as well as the electrical body. And the tongue has a lot to do with it, which is why these things are worth talking about over and over. So
The tongue is like the breaker in the
the
electric system. You put it there and everything
yeah,
goes.
exactly. The tongue's like a breaker. Some people call it like the rudder of a ship. It kind of guides everything, but I think you're right. It's like without that, the whole electrical panel is like kind of dissociated, honestly. Okay, I'm really excited because we have a specific thing. And I want that pictures in between this visit, and we'll do a follow up in 2 weeks where we get to have you working this posterior bit. And I think I might bring on the tongue therapist. She knows so much more than I do because she's seen thousands of people's cases, right? She's who I refer to, the expert. However, most of us don't have access to that. So I really want to give people enough tools to make huge gains all on their own. And I think it's more than possible. And you are proof of that. And you can't see your osteopath anyway. So I think it's time to be your own osteopath.
Yes, it is. Yes, it is. Can't see you now because you're still sharing your screen.
Oh, darn it. You mean you guys can't see me? Okay, wait. Let's get rid of this share screen business. Thanks, that's good. So when I'm sharing my screen, I can see you and I talking, but no one else can. And now I'm trying to get back to, oh, there it is, stop share. Ha, trickster.
There you are.
Excellent. All right, anything before we sign off?
No, I'm just gonna like super motivated to take a picture and do some work and see what happens.
Awesome, me too. All right, well, thanks for joining, everyone. I wasn't able to monitor Facebook, but I just had this idea. I'm going to ask Mark Wendt, he's in our group, to come over and like give me some lessons on how to make this all work better for you folks and for me. All right, so 2 weeks, we will regroup, and I'm so looking forward to it. Mwah! Much love to you, Chantal. Take care.
Bye. Love to you, and thank you, Michelle.
Indeed.
Bye.
1 o'clock on the dot.